Dear viewers, today in this video I am going to discuss about ROX Index, what it is and what is its usefulness and limitations, and when it is used. I am Dr. Sunil Garg from Essentials of Acute Care. The ROX Index is Respiratory Rate Oxygenation Index, and it takes into consideration SpO2 divided by FiO2 ratio and respiratory rate, where SpO2 is peripheral oxygen saturation and FiO2 is oxygen concentration. The ROS index has been validated to predict HFNC or high flow nasal cannula failure among pneumonia patients with acute hypoxemic respiratory failure. It has demonstrated moderate discriminatory power to predict HFNC failure among patients with either pneumonia or non-pneumonia related acute hypoxemic respiratory failure, though it does not consider the respiratory pattern and the use of accessory muscles. How we calculate it? For calculation of this index, the parameters which are considered include the ratio of peripheral oxygen saturation and oxygen concentration, which is expressed as a percentage, and the value derived should be divided by respiratory rate. Let it understand by an example. Assume peripheral arterial oxygen saturation is 90% and the oxygen is 60% and the respiratory rate is 35. Then we will divide 90 by 60 and the value comes as 1.5, which is 150%. Then this value of 150 is divided by respiratory rate of 35 and the result is 4.29. In this example, so ROS index is 4.29. The predictors of HFNC or high flow nasal cannula failure with need for intubation in terms of ROX index include ROX less than 2.85 at 2 hours of HFNC initiation, ROX less than 3.47 at 6 hours of HFNC initiation, and ROX less than 3.85 at 12 hours in one study. In another study, ROX index was most discriminatory in pneumonia patient 1 hour after HFNC initiation with a threshold value of less than 6.06. So, to summarize it, ROX index is respiratory rate oxygenation index and it is useful for predicting HFNC failure and the subsequent need for ventilation in acute hypoxemic respiratory failure, with discriminatory power described at best is moderate. Hence, ROX index is not suggested to be used for prediction of HFNC failure in isolation and must be augmented by clinical judgment. Here I finish. Thanks for watching this video. Please do not forget to subscribe to this channel. I would appreciate your feedback, suggestions or comments. See you in my next video. Till then, bye and take care.